Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with people who are making it happen. We are the fastest growing podcast in the health IT space. My name is Bill Russell. We're covering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is brought to you by Health Lyrics. Health IT, do you need to do more with less? We've been in your shoes. We know where to look. Let's talk. Visit healthlyrics.com to schedule your free consultation. If you're enjoying the show and want to support our mission, as some of you have asked me, there are 5 easy ways you can do it. You can share it with a peer. Second is you can share it on social media. Third is you can follow our social accounts, LinkedIn, Twitter, YouTube. Send me feedback, questions, and recommendations. Bill at thisweekinhealthit.com. I love the news story recommendations and other things. That's very helpful, and especially guest recommendations, very helpful. And you can subscribe to the newsletter on the website. So let's get to the show. Today we're joined by Jeff Johnson, VP of Innovation and Digital Business at Banner Health. Good morning, Jeff, and thanks for joining us on the show.
Good morning, Bill. Thanks for having me. Great to be here.
Man, so that's as you know, as I've said before, that's a great title. Sounds like you get to work with really cool stuff, really cool people. But not too long ago, you were the VP of Digital Health. So there's a lot of change, including a new office for you there in the background. So give us an idea on the role and what it entails to be the VP of Innovation and Digital Business.
Yeah, well, thanks for noticing the nice office I've got here with absolutely no atmosphere whatsoever. But it's, that's actually part of the change here, the growth. I'm on my 3rd job title in 2 years at Banner. This is my 3rd location as well. So we continue to grow this innovation and business, digital segment. But yeah, you're correct. I started with Banner with this notion of a digital garage where we thought, we need to start really making some headway into a digital strategy. And we realized really quickly, well, that's, that we can't toy around in this stuff. This has got to be a core competency and really have leadership at a higher level in the organization. So it's evolved into this role of digital business and innovation. Our approach to this is that it's not traditional IT, it's not traditional marketing. It's a new competency. It's a new area of focus with dedicated leadership and accountability. And I'm in the middle of all of those other areas, but it's the way we've set ourselves up.
Yeah, so that's this whole episode is going to be about digital health and digital consumer and all those things. And so we have some history. I at the Scottsdale Institute, you were on a panel discussion with 4 similar types of roles. But I think one of the things that was interesting from that, panel discussion was it very similar, but every health system seems to be doing something a little different. Was that your feeling as well?
It is. And I get that sense with every health system I talk to, that everybody's kind of cracking this nut a little bit differently. And I'm careful not to say that the way we're doing it is the right way. I think each organization needs to figure out the way to approach it for themselves, and based on their legacy and their skills and their leaders and who they have. But so far, this is an approach that's working for us.
So prior to that, we had some conversations leading up to the panel discussion, and you sort of mapped out, if my notes are correct, I think 5 areas. You have a digital consumer, digital health engagement, digital workforce, digital experience, and digital garage. Is that still accurate, or have you morphed that a little bit?
Well, first of all, nice note taking. That's impressive. I didn't think anyone listened to when I talked structure, but that's nice. That's pretty close. The digital garage, we've sort of pulled back, and just that's just part of digital business. So we really are focusing on those 3 fronts: the consumer, the more deeply engaged patient, and the workforce. And then that digital experience team, which is really consumer-centric design, ties to all of those. And that what was the digital garage is really our interface into IT, where we connect with them. That role is morphed into how do we take these products and these product designs and work really closely with our IT teams to enable them. So basically that's the same, but that's kind of the way we divide and conquer such a big space.
Well, yeah, and so it makes sense. So you have sort of an outward-facing group that's looking at the digital consumer. You have a for lack of a better term, sort of a pop health group that's saying, hey, look, we need to engage these people where they're actually making health decisions, which is 98% of the time, not within our four walls.
Right.
You have to look at the internal user. And this is one of the things we sort of gloss over when we're talking about digital, but everything that's happening within healthcare has a digital flavor to it now and is changing, obviously, the EHR and the digital record. The one I'm not overly familiar with is digital experience, but how would you elaborate on digital experience? What exactly is that?
Yeah, these are interactive designers. So the team are folks that come out of the agency world, out of web design, mobile design. They put the video and they do the consumer research as well. So it's very much we start first with what does our customer want? What is our customer telling us that they want? And then we begin translating that into a product or a solution or a service that meets that need. And the digital experience team is very involved in all of that research and that feedback and that information gathering to help us drive those solutions to something that our customers are actually asking for, rather than starting on the tech side of it and saying, hey, we have a bunch of technology and solutions. What should we give to the customer of what we've got? It's they help us really flip that coin over, if you will.
So you have a digital agency embedded in your group that is getting the voice of the customer, putting together communication plans, helping to design, I guess, or craft the features and those kind of things. Is that essentially what that is?
It's a lot like that, and pretty leveraged team. So outside of my area, we do have a whole consumer insights team in our marketing area that's doing research. So we leverage all the data that we get from that. We measure NPS just constantly at every touch point of our organization. Lots of verbatim things from HCAPS and other things, and so that's part of it. And that'll oftentimes be a starting point. But the design team will actually, as they start building digital experiences and products, they are constantly on a daily basis testing what the concept is with the customer. We do that through sort of a crowdsourcing platform. So every single thing that we're thinking about putting into that digital experience, we run it by our customers and get feedback.
Oh, that's great. So you mentioned NPS. That's that's one of the things I heard from the panel was that more and more NPS is being used as the Net Promoter Score is being used as the as at least a metric to augment the other metrics. So is that something you guys are moving? What metrics are you using to sort of measure your engagement with your consumers and your internal consumers?
Yeah, we're starting to use more and more, right? I think the old metrics of just some kind of a traditional ROI, like are you getting the patient to come in and use a service, or they don't work anymore. So we're looking at lifetime value of a customer in these engagements. For example, we're doing a lot of work right now to rethink the entire emergency care experience. Well, part of rethinking the emergency care experience to the benefit of the customer is they shouldn't be in the emergency room. A lot of times they're showing up there. And if the health system does that and moves them out of there, well, that has an impact on traditional revenue streams, right? And the catchment that we use emergency rooms for. But it's the right thing to do. So we've got to figure out how do we capture the value that we're giving to the customer for doing that. And so sometimes we'll look at the lifetime value of that customer and say, okay, we did the right thing for her. She didn't come in at 3 a.m. with her 2 toddlers and spend 6 hours in the emergency room because she didn't need to be there. But now we've earned some loyalty with her because we gave her the right service that she needed by sending her somewhere else. Lifetime value, Net Promoter Score, all new metrics that we're using.
Well, that's an interesting example that you give because it's one of the conversations. This is why it needs to be digital business, I guess, because to some extent you're changing the business model. Because when that person doesn't come into the emergency room, there's a certain amount of money that doesn't flow the way it used to flow, and it flows in a new way within the organization. So how do you engage the entire business? How do you engage the CFO, the operations people, the clinicians to sort of rethink how we've done things in the past?
Yeah, and I just noticed I lost my light in this new office. So am I in the dark, or can you see me okay?
I can see you fine. There's
okay.
sort of a glow around you, which sort of works.
Oh, that's even better. So, yeah, it's a good question, and you're right. That's where digital business really is the way we're approaching it is different than those traditional areas. It's really how do we change the business digitally, or use digital to change the business. So I like to start, at a really high level. Why does my group exist? Why are we here? And at Banner, we're such a unique system. We've got everything. We have academic medicine, we have community medicine, we have quaternary care, we have urgent care, we have critical access hospitals in rural regions, we've got special departments. You name it, we have it. It's just such a broad platform of care. Our charge in digital is how do we take all of that value and extend it and expand it further and further away from the traditional four walls, so it's influencing our customers' lives much more comprehensively than it is today. Whether that's helping them get into those four walls at the right place, right time, right cost, or keeping them out of them and still giving the care and the help that they need. So we start fundamentally with that kind of a concept and tie that right into our mission and our purpose statement as a company.
Yeah. So how do you prioritize? So clearly you can pick any one of hundreds of workflows and say, all right, we're gonna rethink this one. I mean, how do you sit down as a group and say, we're going to focus on labor and delivery, we're going to focus on orthopedics? Because you can't do it all. I mean, we'll talk about budget in a little bit, but how do you prioritize?
Yeah, so we look at those insights again. We're always looking at what the opportunities are to improve the experience for the customer, and by experience, I mean I include cost and quality as well. And so again, having those channels in my area, we have priorities in each one of those. And so I'll give you an example in the digital consumer. We realized that access was a huge opportunity for us. Our customer needed a better way to access the system. So we put a big priority on just simply accessing Banner. And I'm not talking about so much, the marketing outreach of how you reach somebody and, through social media or through a Google ad buy or those kinds of things, but how do you really make the system accessible? So we've focused in on that as one example, and we built a blueprint. We did some really interesting work with our customers. Rather than, I kind of have this fatigue about journey maps. I don't know if you do as well, but I don't ever want another consultant to come in and tell me that we need to map the customer's journey. I think we've mapped it enough. What we lack is a solution that the customer really wants, not just digitizing the one they have. But we did a really interesting, some really interesting work that we're in the middle of, where we brought in about 25 of our customers, and we just sat down and we had them tell us what the journey really is and what it should be. And we did that using a proxy methodology, where we showed them, here's all these other digital experiences in your life. Here's how you're using Rent the Runway to get a gown for this big event. Here's how you're using PackPoint. Tell us how you're using PackPoint to prepare for a trip. Tell us how you're using LG to buy a refrigerator. And then each one of those we said, now if that was a healthcare service, what would that mean? And so you can imagine, okay, LG is really cool. I can stand 3 refrigerators up to each other side by side, and I can kind of compare cost and quality and availability. And said, why can't I do that with your services? How come I can't compare 3 docs side by side? How come I can't compare emergency room, this doc, and urgent care side by side? And so we took all of that learning and we built what we call the blueprint, which is actually a visual representation of what it could be like to interact with this digitally, both through voice assistant, through native mobile, through web, through chatbot. And we painted this really compelling story. And then to answer your earlier question, we take that out to all those stakeholders and say, this is what Sofia wants. This is what she's asking for. This is how we all need to fit into this, so that revenue cycle isn't building one experience over here on the bill pay. Scheduling is building another experience over here, and patient edge is building it. They all need to come together. So those blueprints become helpful in bringing us all together around that customer.
So Sofia is your digital consumer persona?
Yeah, did I say Sofia? Because it's such a habit here that if I say it, I apologize for saying it without telling you who she is.
Yeah, you did say it. So elaborate on your persona.
Yeah, so this is really I think something that's really worked really well, and this is the all credit to our chief marketing officer Alex Morehouse persona named Sofia, and we have multiple personas that we might use in product development to represent different segmentation. But really what Sofia is a way to take this, this idea, this value that we have, that we're customer obsessed, and this mission statement that we have, that we're going to make life easier, and make healthcare easier so life can be better, to really start to translate that into something tangible that every employee in this organization can rally around. So Sophia became the face of that, and she's a real person. She shows up at leadership events. We have videos with her. We have cardboard cutouts of Sofia that people take selfies with in our hospitals. So every employee rallies around this persona of Sofia, and they think about what they're doing in terms of how does this impact Sofia. So kind of cool. It's really helped in digital and all of the spaces.
I'm sorry. So she's actually a real person who receives care at your facility?
No, I mean she's an actress, I should say, for purposes of pictures of her and those kinds of things. But she needs the real face.
Yeah, yeah. So
it's a human being that people know. Like if you saw her, and people have seen her, if you see her in the grocery store, you would say, "Oh, that's Banner Sofia," even though that's not her real name.
Right, but what that ends up doing is personifying the people we already know. It's the people we work with, the people in our community, the people who stop us at dinner parties and say, "Oh, you work for Banner? You know what would be great? If you guys did this." So she sort of personifies that voice of the consumer saying, "Hey, this is how I want to sort of interact with healthcare. Can you guys do this for us?"
Exactly. And, yesterday was interesting. I did a walkthrough almost all day with a big consumer tech company. I won't mention the name. I don't know if they want me to, but you'd know who they are.
Right.
And they came out to explore some things that we could do together in health. And so we walked through our cancer center. We walked through an emergency room. We walked through an urgent care center. And at the end of the day, they said, wow, never been in a hospital system where everybody cohesively talked about either Sofia specifically or talked about the customer as the very first part of the interaction. So it's worked really well to help do that translation of the mission to something tangible.
So you have internal customers too, though. So you have people whose lives have been really dramatically changed by the introduction of the EHR, and they're ending up adding an hour or two to their day. They're doing a lot of documentation and those kind of things. Are those areas you're looking at, or are those areas you're trying to address?
Well, we certainly are at Banner. I'm not as directly involved in some of the EMR optimizations on workflows and those kinds of things. Some things around the edges, because what we found is that our clinicians are just like our Sofias in the sense that dealing with Banner is big and complex, and having the right kind of access to what you need at the right time at the right cost. So there's a lot of things that we're doing outside of that EMR to improve that experience digitally.
Yeah, so we're doing things around the edge. So talk to me about your partnerships. So strategic partnerships, you're bringing in vendors and I don't know, and other innovation partners. As we've talked about on the show before, and we've talked with others, the models are so varying. You have sort of a model within health systems where they're investors, they're actually VC or even private equity. You have and they're really looking to almost create a new business model. But we're also finding others that are saying, you know what, we already have a multi-billion-dollar business. That's our business. And what we want to do is to optimize that. Talk to me a little bit about your model and how you think about partnerships and how you invite in the innovation community.
Yeah, I think our approach is kind of in the middle of what you said. We certainly are looking at investments and strategic partners. I focus more on what I would consider partnership relations than traditional vendor relationships. So certainly we leverage those. But first and foremost, when we are dealing with a partner, whether we're going to look at investing in them or not, it's can we show that there's real value here at Banner? Is there something that it's really doing to enhance our business model? And then secondarily, if we believe that that is the case, we may choose to invest in them because we think we can enhance their service to the market and help them show that the demonstrated value in our environment. Just a venture fund, just to invest or to build our own software companies just for a go-to-market approach.
So you have to fund this group. People have talked about this and have asked me questions about this. The one that everybody likes to talk about is Providence, because Providence has like 200 people in downtown Seattle that are not a part of their IT organization, but are, former Amazon people, and they're doing all sorts of stuff. And I've had people ask me questions like, what are 200 people doing? I've had other people say, where's the money coming from? And, at some point I'll get Rod Hochman back on the show and I'll ask him some of those direct questions. But how do you fund this, and what roles do you look to put in place?
Yeah, so funding, it's just part of our capital and operational budgets is what we're doing right now. We do have this notion that, especially on the innovation side, we'll create this virtuous cycle where those investments will help bring money back in to drive further growth. But right now, this is part of the way we see doing business. It's going to be done digitally, and so it's an investment that we need to make to do this. A lot of it, though, some of it, Bill, is like the ROIs and some of this are so easy, and it's just such stuff on the top that it makes a lot of sense. So, an example, we have an urgent care service that we provide. And we had, what a lot of organizations have. The customer could come in online and you could capture them digitally because they could make that urgent care appointment. But it was bad. It was a bad experience. It was an out-of-the-box vended solution. When we tested it with our customers, they didn't have a lot of confidence. They didn't really trust it. It wasn't easy to use. So we did a front-end redesign on that. And tied that into back-end systems through the APIs. But the result was, when you design that experience for the customer, we went from an 11% conversion rate online for people seeing that offer to check in online and actually showing up, to a 42% on the day we launched it. So that's an easy thing to say, well, that's a good investment in designing for the customer and providing a digital product that matters, because 300% increase in your digital capture rate for urgent care. That's just one. So there's a lot of easy ROIs to do in digital still in healthcare.
So there's a lot of them. It's not hard to find those kinds of opportunities.
Yeah, there's a lot. I'll give you another quick example. We have a Medicare Advantage population, and we're trying to engage the seniors much more in their healthcare. And one of the ways is to do that is to get them in for their annual wellness visit, get that health risk assessment done. We had about a 0% compliance on health risk assessments for Medicare Advantage folks. And it's because we would ship them a piece of paper, expect them to fill out the piece of paper, and bring it to the docs. So we asked our docs, I go, how often do you see those? They go, what are you talking about? I've never seen them. We created a little chat bot that actually the member doesn't even know they're filling out the HRA, really. They know they're giving this information, but it's not like a form. They're just answering questions in this chat bot. And we went from about a 0% risk assessment completion prior to visit to 51% completion by putting it into a digital modality. And that had an effect on no-show rate. So there was a positive correlation. If somebody engaged with that digitally before the visit, their likelihood to show up for the visit also went way up. So there is some easy picking still. So
Jeff, it's interesting. You said, if I have another journey map, I'm journey map fatigue and those kind of things. But, I am still going across the country. I'm still talking to a lot of different health systems. And while some of them are starting to build out some journey maps and those kind of things, they're not necessarily in tune with the experience that people are. They know that there's areas to improve, clearly. They know that there's frustrations with the consumer. They know that people have trouble getting to where they need to get to. They know there's some obvious low-hanging fruit, but they don't necessarily know where to start. Where should they start?
Well, for us, we started on big access points like the emergency room and urgent care that I mentioned. Those are just, and then we're also working on our primary care access as well. We're just not quite as far down the road as we are on that.
But did you start by saying, look, we've got to get sort of a digital vision in place. We have to get people on board. we have to get marketing to work closely with this digital business team. I mean, was there sort of organizing work that went ahead of that?
Yeah, I think part of the strategy for us is the creation of a digital team, because then you're putting a big stake in the ground that this matters, that there's leadership in the organization, there's accountability in the organization for this to happen. So I always tell people part of the strategy is how are you going to form the structure to pull this off? That's where I guess I would start, is who in your organization owns this?
Yeah. So how do you work with IT? I have a lot of IT listeners. So how do you work with IT?
Well, hopefully very well. We have a fantastic IT team here. In fact, part of this new move that I'm involved in, we're putting some of my digital teams right exactly in the same floor as parts of the IT teams that we work the most closely with. So it's a very, very collaborative joint effort in this space. Every organization is different. My role could live inside of IT in some organizations. At Banner, it made the most sense to put this in strategy. But I think it kind of depends on the organization where it makes sense. But you do need someone that's owning it, that's setting the vision, that's accountable for it.
Yeah, so you're reporting into Scott Nordland, and so that's strategy.
Yeah.
And IT reports up through does it report directly into the CEO or somewhere else?
Reports into our chief clinical officer.
Oh, interesting. That is interesting.
Yeah, and then marketing and my role both report into strategy and growth into Scott.
That is that's fascinating in and of itself. There's so many different areas, and I'm actually going to ask you a bunch more questions after we get on the line, and I'll share those on social media and those kind of things. Because I think there is, I'd love to hear, how do you handle moonshot projects, and how do you handle failures? I mean, failures are a way of learning. How do you change that culture? So some of those questions I'm going to ask after I do the close here for our listeners. I know this is like the third show I've done this on. I'm trying to keep it to a half hour, and it's hard because there's so much to talk to in this topic, but I'm going to try to collect some more. So Jeff, thanks for coming on the show. Great discussion. Anything you want to leave with our listeners, ways to follow you, ways to interact, or anything like that?
You can find me on LinkedIn. It's probably the easiest way. I love collaboration. We're trying to really let the world know that we're open for partnerships and relationships, maybe better than we've done in the past. See a ton of value in that. So,
absolutely. So please come back every Friday for more great interviews with influencers. And don't forget, every Tuesday, we take a look at the news that's impacting health IT. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekinhealthit.com or the YouTube channel at thisweekinhealthit.com/video. Thanks for listening. That's all for now.